Good evening. Hi, good evening everyone. I am Dr. Manisha, and in some time joining me for this live session will be Dr. Manan Vora, an orthoped and a sports medicine specialist, and we will be discussing everything about arthritis and ways to prevent it and ways to treat it. Everything you wanted to know about arthritis from a specialist is what we will bring to you at 6 p.m. and I'm hoping he'll join me soon and share everything you wanted to know. Feel free to ask your questions to us. So about me, I'm Dr. Manisha Mishra. I'm the medical advisor to Charak Pharma. I also am an Ayurvedic specialist with MD in Ayurveda, with almost 20 plus years of experience as a practitioner. Hi Dr. Manan, I can see him there, and we'll be going live in a minute or so. And a good evening again to everybody. And as I said, today's topic is arthritis. Anything related to joint pain, joint health, any questions you wanted to know, any queries you wanted to resolve, we have a specialist to talk to you for the same. Also, I'll be giving my inputs related to Ayurveda for the same. So let's see, we will go live now. Hi.
Hi, Dr. Manisha. How are you?
I'm good. How are you?
I'm great. Just ensuring that I'm visible in the half that is actually allotted to me.
Meant
So
for
is
you.
that fine? You're good with the video. You're good with the audio.
Yes, all good, all good.
That's nice.
We can hear you, and it is so nice to have you on our show for this live session. It is all about arthritis, and people want to know from a specialist. So, before we begin, let me introduce Dr. Manan Vora. I, from what I have read about you, I'm so super impressed. He is an orthoped and a sports medicine specialist. He's also a sportsman by himself. He's done his education from Mumbai, UG, PG in medicine. Then he's gone to IOC, Switzerland, and studied sports medicine. Then he's also specialized, done his MCH in ortho from University of Edinburgh, UK. He, apart from being a sports enthusiast and a surgeon, he also goes to various research conferences and gives talks. He has multiple research papers published. He is a peer reviewer and editor in many orthoped journals. I could continue on, but we have small
That's
time and we want to talk to him and know more about arthritis and joint pain. So let's begin.
yeah.
From
Thank you so much.
before
I
I
just
begin, I
sorry.
will introduce Charak Pharma to you. I
Yes.
am Dr. Manisha. I am the medical head to Charak Pharma. We are the Ayurvedic medicine manufacturers since 75 years. We are present in every segment from gynec to joint health and pure Ayurveda, absolutely safe, efficacious, natural remedies come from Charak Pharma.
Thank you so much for introducing me, Dr. Manisha, and I'd like to take this opportunity to thank you for inviting me to this platform. And and a couple of people are already commenting Hindi, please. So ठीक है हिंदी में भी बात कर लेंगे हम. So thank you so much for inviting me here, and I hope this session adds value to everyone who's joined in.
Good. So my first question, there is joint pain. Most people have it, mostly elderly, but these days young people also complain about the same. So what exactly is joint pain and how do you explain it to the aam janta?
So, of course, joint pain जो होता है उसके various causes हो सकते हैं. So, right from an injury, right from an infection, right from a tumor, right from a degenerative cause. जो degenerative cause जो हम बोलते हैं उसका मतलब है age related cause. काफी सारे reasons की वजह से joint related pains are possible. When it comes to arthritis specifically, we're referring to pain and inflammation and swelling of that particular joint. अभी ये जो arthritis हम जब सुनते आ रहे तो हम we are listening to हमारे grandparents को arthritis होता है या हमारे parents को arthritis होता है, क्योंकि वो जो main concept है arthritis का जो commonly used होता है word arthritis, that is osteoarthritis, which is basically damage to the cartilage which is over the bone and aligning the joint. So that is the main arthritis that people are aware of. But just to put it out there, जो arthritis है, that is, it encapsulates a wide range of other conditions as well. You also have rheumatoid arthritis, जिसमें your body's own immune system attacks your joint. You have other conditions like gout. You have psoriatic arthritis. There are various other things, septic arthritis, reactive arthritis. So there are many types of arthritis that can happen. But main वाला जो हम commonly देखते हैं, that is osteoarthritis. And like you said, yes, we are seeing them in 40-year-olds, people in their mid-40s also, which is a little worrying. But that just goes to show that how much lifestyle has a role to play in this disease pathology. Because when our grandparents were young, जब भी हमारे ancestors का time था, that time lifestyle was different. आज के ज़माने में 21st century में lifestyle is different. So there's a very big difference when it comes to that, and that is reflected in the way the disease is actually progressed and the way we are seeing it in patients today.
So now that we have come to the part that osteoarthritis is the most common arthritis, how prevalent is it in India, in the Indian population?
So, even as someone who's practicing, I can tell you that about 4 to 5 out of every 10 patients walking in is coming with a knee arthritis problem. So that is in itself is large just from my own small sample population. But when I was actually reading up about it, there is actually a 20 to 40% prevalence of osteoarthritis in India. It's the most frequent joint disease that is there. When it comes to women, क्योंकि ये ज़्यादातर women में ही होता है, so when it comes to women above the age of 65, I have read that 70% of women have a sign of osteoarthritis on their X-ray, and about 45 to 50% of them actually have symptoms of osteoarthritis of the knee. So I think काफी establish हो गया है कि ये बहुत ही significant problem है, जिसकी वजह से इतने सारे treatment modalities भी है, काफी options भी है लोगों के पास try करने के लिए, and it is something that is really it's become like a common thing. कैसे अभी cataract surgery लोग कराते हैं, it's almost become like ये तो at some point आपको करना ही पड़ेगा. Similarly, osteoarthritis of the knee, especially in women after the age of 65, it has almost become a situation where yes, you will have to take some form of treatment, or one of the other modalities you will have to treat. So it's as prevalent as that now.
Oh, this is a fact that women are more prone to osteoarthritis than men. But not everybody will have osteoarthritis. That is also a fact.
Absolutely
but
not.
Yes, it is prevalent, and most people will have it, and there must be some specific causes for arthritis to be so prevalent. What can we number a few?
So honestly, I wouldn't want to go out there and call them causes, because I would like to call them risk factors, because there are various things which can increase the incidence of that, and very honestly, genetics plays a very big role. Hereditary problems can absolutely be passed on, and osteoarthritis is one such condition where it can play a very significant role as well. दूसरे risk factors के हम बारे में बात करें तो smoking is definitely a very big established risk factor when it comes to osteoarthritis. Similarly, lack of physical activity, not looking after your bones and joints over time leads to a degenerative condition. Over years, there is wear and tear and damage to the cartilage of that joint that is taking place. And obviously, when you talk of exercise, nutrition kind of comes hand in hand. So if you are otherwise an unfit person, if you are otherwise not looking after your body holistically, you are not looking after your bone, joints, muscles, which is exactly why I try to propagate that on my page. Actually, when I talk about exercise, I have to bring in the angle of nutrition or fitness and all of it together, because it does come hand in hand as well. So I would like to call these risk factors rather than actual causes. I think risk factors is a much better word to put it.
So just to make things easier for people who are joining us, what happens in osteoarthritis, especially in the knee joint? What exactly goes wrong?
So what's happening is you have your bone with you. You have two bones that form I mean, technically you have 3 bones that form the knee joint, but let's for to make it simpler, let's say you have 2 bones, and when they join at one point, it's what we call, उसको हम joint बोलते हैं. तो बोन के सराउंडिंग लेयर पे एक आर्टिकुलर कार्टिलेज होता है. सो ये बोन पे भी एक आर्टिकुलर कार्टिलेज रहेगा, ये बोन पे भी एक आर्टिकुलर कार्टिलेज रहेगा, एंड देन दे विल आर्टिकुलेट और दे विल जॉइन टू फॉर्म व्हाट वी कॉल अ जॉइंट. ये जो आर्टिकुलर कार्टिलेज है, इसका जब लाइनिंग को डैमेज होता है, दैट इज व्हेन वी से दैट नाउ देयर इज आर्थराइटिस टेकिंग प्लेस, बिकॉज देयर इज damage to this lining or the cartilage of that joint. Now when the overall covering and the layer of the bone, which is the cartilage, gets damaged, over time that cartilage is basically the cushion that is there between the 2 bones. Over time there will be a bone on bone impact, which is what we call as bone on bone disease, and that is when the pain increases so severely, or a bone on bone disease, you can say, is one of the main indications when a total knee replacement is required, जो काफी आगे स्टेज पे आता है, उसके पहले भी काफी स्टेजेस होते हैं. That is when, you know, the pain really increases. आपका जो range of motion है काफी affect हो जाता है. You're not able to, you know, squat down. Let's say आपको अगर Indian toilet use करना है या एक deep squat करना है, you're unable to do it. Or even if you're lying on a bed, you're folding your knee and trying to get your heel to your buttock, you're not able to do it because your range of motion has now been affected. So that is the entire disease pathology that takes place with osteoarthritis, specifically of the knee joint. This can obviously happen in any other joint as well. अभी मैंने जो explain किया है वो natural wear and tear over age and degeneration की वजह से हुआ है. There are also other ways कि वही exact pathology हो जाए. The exact articular cartilage can get damaged in other ways as well. So how can that happen? Either there is an infection which is eating into that joint, or it is damaging the articular cartilage, or you have had an injury, you have had an accident, you have had other problems because of which the normal joint anatomy has been disturbed. There is a structural damage that is there in that place, and because of that, the same articular cartilage, which over time was getting degenerated and causing a problem, has now happened at a younger age because you had an injury or you had an infection or any other reason. So osteoarthritis of the knee can happen itself also because of various other causes, by causing damage to that articular cartilage of the joint.
So basically, एक और सवाल इसमें मुझे ऐड करना, are sports people more at risk because they have multiple injuries to their knees, or are they more prone to osteoarthritis? The risk factor increases?
So definitely, it again depends on the sport, because we are not seeing this in cricketers, but definitely in footballers, they are prone to get it. At least the male footballers will be far significantly lesser. Again, the amount of research that is there for a 65-year-old female footballer in 2022 is significantly less. So yes, as of now, we are at a point where we are saying that obviously your knees have taken more load, more damage, more wear and tear over years of 2-3 decades of non-stop sport, and because of which, yes, your knees may be damaged to a particular point and may lead to earlier arthritis. However, when you go back to the risk factors of arthritis, which are lack of exercise, improper nutrition and all of that, they have done those things very well throughout as well. So to come up with a blanket statement saying that if you are an athlete, if you are a sportsman, aapko jaldi arthritis hoga hi, is also wrong, because the genetic component comes in as well. So again, natural wear and tear and damage can also happen because of excessive loading and excessive sport over 2 or 3 decades of time, or due to certain injuries that can happen in sport. But it can also happen in someone in a sedentary lifestyle due to lack of physical activity and lack of improper nutrition and due to genetics. So दोनों तरह से हो सकता है, which is why we're seeing such a high prevalence. But again, बहुत ही मुश्किल है to say that every sportsman को होगा या every sedentary lifestyle person को होगा, क्योंकि that's not true.
एक सवाल जो मुझे पूछना ही है, people who break their knuckles all the time, are they prone to arthritis?
Not at all, and I've done a video on this as well. There is absolutely no connection between breaking your knuckles or cracking your knuckles or whatever it is and actually arthritis. This is a very common myth which I have busted long ago on my profile. But again, there are various theories why the knuckle cracking makes this sound. The most common theory is that there are nitrogen bubbles that are present in the joint. Again, this is a hypothesis, but it is the most accepted hypothesis, is that there are nitrogen bubbles that are present in the joint. And when you basically move your joints in particular ways, the sound that comes is the bursting of that nitrogen bubble, which is the sound you are hearing. It has nothing to do with your bones. It has nothing to do with arthritis. So definitely क्रैक नकल्स आपको जितना क्रैक करना है करो, कुछ फर्क नहीं पड़ने वाला.
See, that question was important. So, what
Absolutely.
are the सबसे early signs of osteoarthritis of the knee? क्या है?
So again, it is, we are seeing a different presentation in different kind of people. कुछ लोगों को पेन स्टार्ट होता है, कुछ लोग को स्वेलिंग स्टार्ट हो जाती है, कुछ लोग को रिस्ट्रिक्शन ऑफ नी रेंज ऑफ मोशन. दे रियलाइज दैट यार पहले मैं तो इतना स्क्वाट कर रहा था, अभी मैं इतना स्क्वाट नहीं कर पा रहा हूँ. सो दे आर डिफरेंट प्रेजेंटिंग कंप्लेंट्स विथ विच अ पेशेंट वॉक्स इनटू आवर क्लिनिक एंड गिव्स अस अ पर्टिकुलर symptom and a particular history, and then we undergo an examination. We look for the tender spot, we check for the knee range of motion, and most times it is early signs of arthritis as well. So again, for someone who has limited information or just wants to know ki yaar mujhe doctor ke paas kab jana chahiye, so the main answers are pain, swelling, and range of motion being restricted or stiffness in any way. So these are the
मतलब
main three ones that everyone should keep in their mind.
मैं सीढ़ी अगर ठीक से मैं सीढ़ी चढ़ूं या उतरूं और तब मुझे दर्द हो तो आई शुड बी वरीड.
Not exactly, because in early stages of arthritis, जो आप सीढ़ी चढ़ रहे हो और उतर रहे हो, वहां आपका नी रेंज ऑफ मोशन इतना ज्यादा डिग्रीज में नहीं जा रहा है. So you may be very comfortably able to climb stairs and climb down in early stages of arthritis. But if you are having problems in coming down stairs, then we are worried about other ligament problems in the knee or a meniscus problem or other knee pathologies apart from arthritis. So you still need to be worried and get checked, because बाकी चीजें में भी problem हो सकती है, but in just that much degree of range of motion getting pain, it's unlikely to be arthritis while coming downstairs.
मुझे अर्ली साइंस ऑफ आर्थराइटिस, ऑस्टियोआर्थराइटिस पता चल गए हैं, पर मुझे तो डॉक्टर के पास नहीं जाना है, मुझे तो प्रिवेंट करना है घर में, तो मैं क्या करूं?
So early stages पे what you can do is just focus on your see, जो wear and tear हो रहा है, that over time has already taken place. So it is going to be very, very tough to reverse that completely. So what you have to do is try and do some physical therapy, try and do some exercise, try and work on your lower limb muscles, quadriceps, hamstring, strengthening muscles. There are great physiotherapists also who do a lot of physiotherapy, and they really give great results as well for early stages of knee arthritis. Apart from that, you have to look at your weight. You have to ensure कि आप अपने वजन को कंट्रोल में कर रहे हो, आप अपना न्यूट्रिशन कंट्रोल में ला रहे हो. Try and be on a low, try and watch your calorie intake, calorie output, and try and make sure that you are consuming an anti-inflammatory diet, you're having omega rich foods as well. These are all the various things that you can do, but I would still keep this as advice for someone who's between 20 and 40. Once you are 40 and if you have reached a stage when you have already done a significant damage, obviously all these points come into application for not increasing the severity. But the damage that has taken place, because it is articular cartilage damage, it's not going to magically reverse on its own. Your job is to try and then become a patient and then try and control the symptoms. How do we improve the range of motion? How do we take away the pain? How do we take away the swelling? And those are all the factors that then we start looking into, and that's where our role comes in, and itna sara jo bhi hai treatment aata hai. But otherwise, all those points which are risk factors, to try and avoid them and work towards them, that is ideal for someone 20 to 45. Great thing to do. Or someone who has not got early signs of arthritis, the same advice applies for 20 to 55 for that matter.
एंड एनीबडी जिसके घर में जेनेटिकली ऐसा कुछ लक्षण है, तो उसको तो 20 साल में ही केयरफुल हो जाना चाहिए कि ही हैज टू बी टेकिंग केयर ऑफ हिमसेल्फ. वो होता नहीं है. द प्रॉब्लम इज वी आर सो ससेप्टेबल टू सो मेनी थिंग्स इन लाइफ कि इट कैन नॉट बी स्ट्रीमलाइन. होना तो है.
Absolutely.
So we have talked about lifestyle changes, we have talked about diet. Do you want to tell me about supplements which are useful?
Yeah, absolutely. So हम जो supplements use करते हैं हमारे practice में, there are great supplements like glucosamine, chondroitin sulfate. These molecules are there. Nowadays we are getting curcumin, we are getting boswellia, we are getting rosehip extracts. So over time, a lot of these plant-based molecules have been made, and there are decent studies showing that there are great results that people are finding, at least in the preventive aspect or in the early stages of arthritis aspect for sure. So ये जो molecules है, they are, studies have been conducted, और इनके जो anti-inflammatory or antioxidant properties है, they are working very well, especially for the synovial joints, and they are giving great results. So I believe you have some experience with that as well. Would you like to share some of that?
Yes, I will. So, as I said, we are from Charak Pharma and we have natural supplements and Ayurvedic medicine in almost all segments of your health care. So, we do, like doctor said, there is glucosamine, but glucosamine has two molecules. One is glucosamine sulfate, one is glucosamine HCl. So just a little trivia and a little gyan on this. Ki glucosamine HCl has 99% pure glucosamine and it is taken up well by the body, and a 1500 milligram of glucosamine HCl is equivalent to a dose of 2600 milligrams of glucosamine sulfate. So my combination of Go 365 contains glucosamine HCl along with chondroitin. These are natural what you say products made by the body, but over a period of time we are unable to sustain that glucosamine supplementation by the body, and we have to give it something from outside, and it is meant to reduce your inflammation of the cartilages that we were talking about. It helps to improve that joint health, and obviously these things are not, it does not do chu mantar, but as I said, supplements slowly start healing your joints and they are good. Apart from that, since I'm an Ayurvedic doctor, there is haldi, there is salaki, salai gugul, which are amazing antioxidant and anti-inflammatory, and they are needed for such kind of care, for joint care, especially osteoarthritis care. You also need vitamin D and calcium. So if you want
Of
to
course.
find something completely together, you can try Go 365 tablets. As I said, all these things are present there, along with ointments, which Ayurveda uses profusely. We use a lot of oils. And अब देखो तो हम जैसे इंडियन लोग हैं, हमको तेल का बड़ा शौक है,
जी.
ऑइंटमेंट्स का बहुत शौक है. हमको वो खुशबू से पता चलती है कि हम किसी बुजुर्ग के घर में, there is a smell when you enter somebody who is 65-year-old. There's always
Mhm.
this essential oil smell which will remind me of some balm and some oil. So
Absolutely.
yes, we have such ointments which has eucalyptus, menthol, camphor, which are all soothing to the joint and they help
Absolutely.
relieve joint pain.
Absolutely, and
So yes,
I
we
think
have.
the advantage with that is you don't have to worry about limiting the number of times per day. Also, they can be doing it, because when we otherwise prescribe like a pain gel or a spray, which has diclofenac and all, then we want it to limit it to a particular number of times per day. With those products and those molecules that you mentioned, उसका भी freedom रहता है कि दिन में 2, 3, 4 बार आप लगाओ. At least there is nothing that is going to go wrong. At least, so that is one very big benefit of the natural ingredients that you have for sure.
Yes. Uh, my mom did a lot of oiling. Okay. See, oils, there is one thing, as doctor said, there are multiple stages to it. You have to, it is a temporary pain relief, but it does give relief, so you can definitely try it. There were many people asking about joint pain. People have had some joint repair or joint replacement, and their parents are there, and how should they take care of it? If you could just answer in a few
So
words, that
So
would be helpful.
whenever you undergo joint replacement, and I say this all the time, the orthopedic surgeon's job is as equal and important as the post-surgical physiotherapist's job to try and do the post-surgical rehabilitation well and get the patient back to their day-to-day activity. So कभी कभी क्या होता है कि सर्जरी हो जाती है और हमें लगता है कि चलो हमारा काम हो गया, it's all done. Even the patient or the relatives think, chalo, the big thing is done, because surgery is such a big thing, obviously. But they need to understand that जो आपकी सर्जरी के बाद का जो काम है, आपका 50% ही अभी तक काम हुआ है, बाकी 50% आपको खुद अपने मेहनत से करना है, अच्छे गाइडेंस के साथ करना है, अच्छे फिजियोथेरेपिस्ट के साथ करना है, because that is what will eventually get you back to walking. I'm assuming you're talking of hip and knee replacements. So either way, right from a bedside mobilization to walking with a walker to walking with a stick and eventually walking without it. So it is an entire process that you have to go through under proper guidance, and your surgeon will also be there to guide you with it. So it does take time. Again, it's very tough for me to give a timeline because certain joints are different. replacements happen partially, they happen completely. The age of the patient, the weight of the patient, the pre-surgery lifestyle of the patient, many other factors come into consideration. So I cannot say someone will be okay in 2 weeks, 1 month, 3 months. It's impossible to say that in an audience like that. But as long as the process is followed over time, of course, the results are absolutely great for any arthroplasty now.
Lavanya, I hope you got your answer because there is no cut. It's all subjective. Every patient is different and every patient reacts to surgery in a different way. So some people will recover faster, some people will take time. There is no fixed time limit. And if there are people still have pain after surgery, do you want to say something on that?
So pain after surgery is completely a completely a different thing. There could be something that could be bothering the patient. It could be a post-surgical acute infection. It could be a delayed infection that could be a problem. Maybe your body has not reacted to the implant that has been put in, so there could be a reaction being caused because of that. Or it could be just general post-surgical pain, which will just die down over time. Either way, if it is not being controlled by medication, because usually you will be given painkillers after your surgery as well. If it is not being controlled, you definitely need to go back to your surgeon, who will probably do an X-ray of that joint and make sure everything is okay. And if not, then obviously the further treatment will be accordingly.
Okay. One question I need to ask people who have osteoarthritis, we miss this. They are very keen on doing yoga and and they do it by themselves. They'll sit in Vajrasan, they will fold their knees. How good is that? What do you suggest? What suggestion is there
So,
for such people?
so again, very tough to give an answer that is, open, because next thing you know, someone will message me afterwards saying, "आपने बोला मेरी मम्मी ने कल योगा किया, अभी ये हो गया है." So very tough to say that.
That's
Again,
right.
it depends. Again, it depends on the age and weight of the patient. Very honestly, it depends on how the surgery has gone.
No,
How
not
beautifully.
surgery, just osteoarthritis.
Oh, you're not
And
talking
then,
of post. You're not talking of post TKR.
no,
Oh, okay.
not post.
Oh,
Generic.
then it's absolutely great. So I am of the belief that even someone with arthritis can do yoga, can do strength exercises, can do swimming, can do walking, can do running. Many orthopedic surgeons think differently. Many of them say that you should not do a few things, but I am not convinced. I believe everything can be done. Again, it depends on what research you follow, what your beliefs are, what your seniors have taught you. It depends on a lot of things. But I'm of the belief that movement is life and activity is everything. And I do not tell a single patient to not do a particular thing unless there is a logical reasoning behind it. In osteoarthritis of the knee, I have not felt the reason to tell anyone that, because if your knee is otherwise healthy and the articular cartilage is the only thing that's damaged, I don't see why you cannot do yoga or you cannot do any of those exercises.
Okay,
Of
superb.
course, if it's restricting your range of motion and causing pain significantly, that's a completely different thing. I'm saying अगर X-ray में मुझे osteoarthritis दिख रहा है और आप बोल रहे हो कि आप otherwise ठीक हो, योगा कर सकते हो, I would not say no.
Again, it's very subjective. I just asked this question because many people start doing yoga on their own. So they should always see, I feel everybody should seek some sort of expert
Absolutely,
opinion before starting
absolutely,
anything. It could be a supplement, it could be Ayurvedic medicine, it could be surgery. Please take proper opinions before
absolutely,
trying anything.
absolutely. I agree with you.
Yes, because क्या होता है, everybody becomes a doctor. This is a discussion between two people. You just take the best things which come out of it, which are useful to you, and try and talk to your doctor. Ki, can we try this? And can we do this? And then go ahead and move on.
Absolutely.
So, yeah, this. So with that, you want to add something more to osteoarthritis of knee and anything that has been any pro tip so that a 25 साल का लड़का और लड़की should be very very careful and not do it ever.
So the reason I will add this pro tip is because I feel it is not a tip for osteoarthritis. I feel it's a tip in general in life. So personally, अगर आप मेरा भी Instagram देखेंगे, I keep talking about people should be moving, people should be doing physical activities, people should be exercising, people should be aiming to live a life with better life expectancy, with a life with doesn't limit you in any way or the other. And that does come with a healthier bone, joint, nutrition, your own weight, and any other things apart from heart health, of course. Now the thing is that लोगों की mentality ऐसी है कि उनको चाहिए एडवाइस फ्रॉम द एस्पेक्ट ऑफ वेट लॉस, कि आप हमें बताओ कि हाउ कैन आई लुक बेटर, हाउ कैन आई लुक बेटर इन एन आउटफिट, मेरा साइज कैसे कम होगा, how can I consume lesser calories so that I lose more weight. So while that is not something I'm completely against, because obviously you should want to be as fit as possible and look as healthy as possible, you need to understand that we are looking at heart health, bone health, joint health, prevention of diseases like hypertension, diabetes, osteoarthritis, all of these things. And the advice eventually comes down to exercise and nutrition. So if your aim and your motivation is looking better aesthetically and impressing someone or fitting into that dress, I am very okay with it. And I say that also. Ki I don't mind what your purpose is, as long as your goal and my goal is the same, which is to get you healthier and prevent lifestyle diseases like these. So continue exercising, continue eating as healthy as possible. I try to do that myself and try and set an example. No one's perfect. Obviously, we're all on this journey together and everyone has ups and downs in that journey. It's not like I'm living the most ideal life possible as well. But avoiding smoking, exercising 5 times a week, at least 30 minutes, and eating as healthy a diet as possible, trying to be in a calorie deficit and aiming to lower your fat percentage is what I focus on, and not weight, is the way to, in general, be a healthier individual in life. The fact that all of this today applies to our topic of arthritis and osteoarthritis is a different thing, but this is in general for lifestyle diseases. So that's just my takeaway.
Absolutely super. To summarize everything, we have talked about arthritis, osteoarthritis, the risk factors, the common symptoms or which you would observe when to visit a doctor, what kind of supplements, what kind of food, and majorly the lifestyle changes. It is related mostly to your lifestyle, so please get it corrected, get yourself together. It's At my age, I'm much older than you. Being fitter makes you feel so good that you could run a 10-kilometer marathon or you could go for a trekking and not complain a bit. That is happiness.
That's great. Yeah, I'm sure you're an inspiration to everyone watching this. If you can do that, that's great.
So nice talking to you, Dr. Manan. Hope we'll connect again. Thank you
We will.
again to everybody who has joined us. And Charak Pharma thanks you. Dr. Manan, many thanks and have a great evening.
Thank you so much. Wish you the same. Thanks for having me. Goodbye.
Goodbye.